Now, for those people that have really bad teeth, they have gum disease, bleeding gums, bad breath, loose teeth. They know one thing, they don't want a denture,
Right.
as you say.
Correct.
What's the process of getting your new set of teeth that don't come in and out at your practice?
Particularly the lower denture, which is sort of kind of the bane of dentistry. We call them floating dentures. Think about in your mouth how active things are on the bottom. The lower lip when you're speaking and talking and smiling, that tongue constantly moving to pronounce the S's and the F's.
Okay.
That's a very active situation. And that bottom denture, with nothing holding it in, flops and floats around. It's actually in my office, and we view this as sort of substandard care. I wouldn't do that in my office. Now, if they have teeth, there's just one little hurdle that we need to sort of overcome, and that's the body's own healing process.
Okay.
If you remove a tooth, well, what was there is now gone, and that needs to close the hole and mature. On most of our patients, the way we treat them, we want to speed them to the finish line. So we have techniques that help the healing process. That healing is a 1 month, 4-week healing time. Now, they're not without teeth, don't get me wrong. Other offices do that, not us. We place the implants the same day that we remove the teeth. So the new anchors are already there. We place the interim set of teeth, a temporary set of teeth that goes over and babies the gum. Think of it like a Band-Aid on a cut. It's going to heal faster if you protect it.
All right.
So in the mouth, as the body's healing, we're just playing the waiting game. And as soon as the body is mature, it's finished healing from those extraction sites. It does all of this on its own, but we help it, speed it along the process, and make the healing time as minimal as possible, because as soon as the mouth is all healed, implants are ready to go. They've already been doing a job during the healing process. A second, final set of teeth is made because it's going to match the contours and the shape of the gums. So when it matches perfectly, that's that good seal. No food gets trapped under it. The teeth go right into place at the perfect spot. And we get to decide on the first temporary set of teeth all of their little nuances of, ooh, I like this, I don't like that. Some people want a gap between their front 2 teeth.
Is that right?
So we want to make it just the way they want it, and we get to prove that in the temporary, the first set of teeth, and then finalize it in the second set that fits perfectly. Because amazing thing about the implants, if you didn't have the implants in, you lose bone every year.
Okay.
And bone goes away because there's no job. Its job used to be to hold the teeth. With the teeth gone, we need to have the implants in there, which actually fools the bone. The bone's not smart. The bone's not brain cells. The bone just does the job you give it. And now the job of that bone is to hold the implants, and we trick it because it thinks it's holding on to teeth.
So it keeps your face from sinking in?
All of those bone loss issues that are denture specific, floating denture specific, are erased when you place implants in because we fool the bone. It thinks it's holding teeth again, so it doesn't go away. And that's the only extra step for our patients who have teeth that we need to transition. If they're failing or they have gum disease, we're making their body much more healthy by getting rid of all those little hiding places around their natural teeth for bacteria, little cavities, little holes. It's actually worse to keep those teeth in than it is to remove them, let the body heal, and the implants are immaculate. They're sterile, they're clean, very easy to maintain, and now we're snapping teeth in or we're cementing teeth in permanently based on what option that they choose with us, and sky's the limit. Food, enjoyment, and they look stunning. They look beautiful.
Now, is this true? So at your center, right? And correct me if I'm wrong here.
No.
I guess how dental implants are typically done is you go to one place. It might be an imaging center. Get that done. Then you go to the surgeon. He places the implant. Then you go to another doctor, puts the teeth on top. And then you may go somewhere else for them to maintain it. You do all that right there. Is that why you're able to do it faster? Like what other? I mean, I hear doctors 10-month process. And you're doing it on the second visit, giving them teeth that don't come in and out.
We have another option.
Is it because you're doing it all right there? Is that why the speed, or is it more to it?
Another option in our area, which takes on average 16 visits, 16 appointments to get done. And you're right. Who wants to be a human ping pong ball? Going from office to office to office, I would probably get confused myself. Where am I supposed to go today? If I've got this happening here, this here, driving all over town. You're right. If you get to do it all in one location, there's the surgical aspect, which you want a scientist for. There's the beauty and the handsome design of the teeth that you want an artist for. Happily, Dad was a dentist. Mom was an artist. painted all the paintings
That's
that
where
I
you
have
got it.
in my office. So a great little combo. Thanks genes, thanks genetics. And we're able to do it all in one place. So you wake up that morning, you don't say which office I'm going to. You're going to come see us. You're going to come see me. And we're going to fix as efficiently and as quickly as possible to get you to the finish line.
Now we should mention, because like you say, at other offices, it may be 16 visits. You used to do it that way, right?
I
When you were
have the
first
option.
learning? No, I mean, in the old days,
Day one in my
20 years
practice.
ago, that's what you had to do, right?
20 years ago, day one in my practice, there was an option of A or B. And the A is the long path, and the B was only emerging as the new, shorter, more efficient path. And it's all developed in the USA. It's all based here in the US, and it's technology and science right here from home. And it was the better implant. It was the faster, smarter, less invasive implant. My practice started with the old style, the bigger, more invasive style, about 60%, and I was 40% new because you're working with both. Now, 20 years later, we're 90 new. There are rare cases where we have to use the old and some of the bigger implants. There's reasons why it doesn't likely apply to the patients. Very rarely do we need it. But that new, we've embraced. Other offices in the area are starting to say, hey, we do these minimally invasive implants too. Been there, done that. I'm the teacher. We've been doing it in our area for 20 years. Locally the expert. We've been waving the mini implant flag in Charleston, in Myrtle Beach now, and moving to Savannah shortly. And we're
And this is your focus. I mean, this is all you do.
It is what we love.
Right?
It's what we have passion for.
Like you're not doing, people off the street, cleanings and cavities. You're pretty much
Maintenance and
dental
cleaning
implants.
is important, so we're
I
going
mean,
to
for
clean
your current patients, you're taking care of
and
them.
protect all of their implant care. We do want to see you for 6-month visits after those appointments. So we're maintaining the health, basically protecting your investment because it's going to last you a lifetime.
And they can eat whatever they want.
That's it. No
Doesn't
limitations.
matter how old they are.
If there's a meal, something on the menu, if you have a favorite meal you've missed, go right after the peanut butter brickle, the pecan chews, all the great Southern food, half butter and half whatever flavor you want.
Okay.
We'll let you enjoy it.